Hey guys, Dr. Luke Stringer from Advanced Health Chiropractic. I'm discussing low back pain with you. So when we're discussing low back pain or evaluating low back pain here at Advanced Health, we focus on essentially three main areas: the structure of your spine, the function of the joint, the integrity of the soft tissue. So unfortunately, today's society, we have to sit for a living. Sitting is the new smoking, right? The average American sits for about 14 hours a day. So when you evaluate a spine that's within normal limits, particularly in the low back, you should be able to see a nice even curve. We have that curve to displace the weight of our body evenly into the joint, into the back of the joint here, while we have all this into the back of the bone, hence why we have all that extra bone back there. However, all those repetitive stresses over time shift our spine out of alignment, and what we tend to see is a lack of the curve. So what happens is our weight transfers forward and you create a massive amount of what we call intervertebral disc pressure. And when we're continually loading those discs with excess pressure, over time those discs degenerate and break down. Exactly how do they break down? So you evaluate a healthy joint, i.e. a spine that's in alignment, you should be able to see a disc that's nice and plump and has a big nerve canal for the nerve to come out of. However, what we tend to see is when we lose the curve within our spine, we start seeing degeneration in the joint. We lose a lot of the disc height. When we lose a lot of the disc height, the fluid starts to leak into these nerve canals. And when we have fluid that starts to leak in the nerve canal, that's going to create pain in your lower back or pain that refers to your extremities. So at Advanced Health, we can objectively change the shape of your spine. And we can do it through chiropractic biophysics and how we use traction to our advantage to essentially address the curvature in your spine. So through specific x-rays, we can biomechanically assess the curvature in your spine, and through specific treatment, decompression therapy and traction, we can contact the mid portion of your low back and we can bring the curve back into your alignment. That's going to take stress and tension off the disc, it's going to slow down that degeneration, it's going to create better loading into the joint and the tissue. Essentially, it's going to allow you to live without any low back pain. So how do we do it? So we call this piece of equipment the target force. Many of our patients call it the torture device. It's absolutely not that. Most of our patients fall asleep in here. It's really palatable, offers pretty much immediate relief. So essentially, through the diagnostic exam and x-rays, we can evaluate where we need to put your spine. And essentially, all we're going to do, we're going to pin down these hips, and then we're going to bring the lumbar belt underneath, right in the middle of the lumbars. And Suzanne's going to control the tension. I'm just going to add some tension to the spine. Suzanne's going to feel a stretch. She's going to tell me when. And we're going to hold the spine there for 6 to 10 minutes. And by holding it there for 6 to 10 minutes, it creates a creep effect. The ligaments in your spine are allowed to heat up. And as they heat up, it allows your spine to stretch back into its normal position. So we can objectively change the shape of your spine, offer long-term results for your low back pain. If you're suffering from low back pain, you've got a co-worker, a family member, friend that is, I recommend sharing this video, clicking the button at the bottom of the video, fill out the contact form, hear from us very shortly, come on in and we'll get this low back pain corrected for you.